As we age, our bodies go through many changes, some expected, others not so much. One of the most worrying changes is the loss of balance. Many people only realize how important it is when they start to feel dizzy or unsteady when walking. And the most surprising thing is that this loss may be related to the medications you take every day. In this video, you will learn about 10 common medications that can directly affect your balance and increase the risk of falls. Watch until the end, because the last one on the list is one of the most commonly used, and few people know about its dangers.
1. Antidepressants.
In addition to depression itself being a problem for balance, medications used to treat depression, especially SSRIs, selective serotonin reuptake inhibitors, such as fluoxetine, sertraline and paroxetine, can also cause instability. This is because they alter the brain's serotonin levels, a neurotransmitter that influences mood, sleep, and sensory perception. Some people report feeling like they're in a boat, even when standing upright. If you're taking antidepressants and notice a loss of balance, talk to your doctor about adjustments or alternatives. 2. High blood pressure medications. Almost any medication that lowers blood pressure can cause dizziness, especially when you stand up quickly. This is because blood flow to the brain decreases, which causes a lightheaded sensation. Diuretics and beta blockers are among the most commonly used. If you notice dizziness when changing positions, talk to your doctor. You may need to adjust your dose or change your medication.
3. Sleeping remedies.
Both prescription and over-the-counter medications can affect your balance. They work by depressing the central nervous system to induce sleep, which affects coordination even after waking up. The FDA, U.S. regulatory agency, even requires that some medications carry warnings about this risk. Before resorting to these medications, it is worth considering strategies such as sleep hygiene, relaxation techniques, and cognitive behavioral therapy. 4. Anti-allergics, antihistamines. Many people don't realize it, but allergy medications can also interfere with balance, especially older ones like diphenhydramine. They block histamine, a substance that is also involved in maintaining alertness. The result can be drowsiness and loss of stability. Newer versions cause fewer side effects, but they still deserve attention. 5. Diabetes medications. Diabetes itself poses a risk to balance, due to possible nerve damage. However, insulin and some classes of medications such as sulfonylureas can cause hypoglycemia, a sudden drop in blood sugar levels, leading to dizziness, mental confusion, and falls. Monitoring blood sugar levels and knowing the warning signs is essential for those taking these medications.
6. Heart medications.
In addition to blood pressure medications, other medications used in cardiac treatment also pose risks. Digoxin, for example, used in cases of heart failure and arrhythmias, can cause dizziness and changes in vision. Antiarrhythmics can interfere with the functioning of the inner ear, which is essential for balance. 7. Anxiolytics, benzodiazepines. Medications such as diazepam, alprazolam and clonazepam are indicated for anxiety, but they act by depressing the central nervous system. This compromises coordination and balance, and the risk is even greater in the elderly. Studies show that the use of these medications can increase the chance of falls with injuries by up to 44%, especially in the first few weeks or after increasing the dose.
8. Analgesics and opioids.
From simple painkillers like paracetamol to more powerful opioids, all can affect balance. Opioids, in particular, act on the brain in ways that impair coordination and cause drowsiness. This significantly increases the risk of falls and can also affect judgment. Be alert to the warning signs, even with seemingly harmless medications. 9. Parkinson's medications. It is curious to think that the very medications used to treat Parkinson's, a disease that already compromises balance, can also cause dizziness. This is because medications such as levodopa can cause a drop in blood pressure when standing up, causing instability. Monitoring and dose adjustments are essential to minimize these effects. 10. Antibiotics, aminoglycosides. Although rare, certain antibiotics, particularly aminoglycosides, can damage the inner ear, permanently affecting balance and even causing hearing loss. They are only used for severe infections, but if you are prescribed an antibiotic in this class, discuss the risks with your doctor. What to do if you are taking these medications. Do not stop taking any medication on your own. In many cases, the benefits outweigh the risks. However, it is essential to be aware of side effects and follow strategies to reduce the chances of falling. Tips to reduce the risk of falls. Talk to your doctor regularly. Review your medications periodically, especially if you notice changes in your health or balance. Get up slowly. When getting up from a chair or bed, do so slowly to avoid drops in blood pressure and dizziness. Practice physical exercises. Activities such as walking, yoga, Pilates or Tai Chi help with muscle strength, flexibility and balance. Stay hydrated and maintain a balanced diet. Dehydration and nutrient deficiencies directly affect body stability. Calcium and vitamin D are important for bone health. Re-evaluate your medications frequently. Over time, your body may react differently to medications. This requires ongoing medical review. Tip 6. Get regular vision checkups. Vision is essential for balance. Any uncorrected visual problem, such as myopia, cataracts or glaucoma, can compromise your spatial perception and increase the chances of tripping and falling. Therefore, keep your eye exams up to date, and if you wear glasses or contact lenses, regularly check that your prescription is up to date. Tip 7. Avoid excessive alcohol consumption. Alcohol alone can affect balance, motor coordination, and reaction time. When combined with medication, the effects are intensified. This interaction can cause drowsiness, confusion, and instability. If you are being treated with any type of medication, especially for the nervous system, avoid or limit your consumption of alcoholic beverages as much as possible. Tip 8. Make your home environment safer. Most falls happen indoors. Small adjustments can make a big difference in your safety. Remove loose rugs, install grab bars in bathrooms and on stairs, use non-slip flooring, and ensure that all rooms are well lit, especially hallways and bathrooms at night. Tip 9. Watch for signs of hypoglycemia. If you are diabetic, monitor your glucose levels frequently. Hypoglycemia, a severe drop in blood sugar, can cause dizziness, blurred vision, confusion, and fainting. To avoid these episodes, follow a balanced diet, eat at regular meal times, and adjust your insulin or other medication dosage as directed by your doctor. Tip 10. Consider alternative and complementary therapies. In addition to traditional medical care, some complementary therapies can greatly help in rehabilitating balance. One example is vestibular physiotherapy, which works directly with the vestibular system, the part of the inner ear responsible for balance. It is especially recommended for those who suffer from vertigo, labyrinthitis, or other related disorders. How medications affect balance as we age. As we age, our bodies begin to metabolize medications more slowly. This is because the liver and kidneys, the organs that eliminate substances from the body, lose some of their efficiency. As a result, medications remain in the body for longer, which increases the risk of side effects. Furthermore, the brain also becomes more sensitive. Medications that act on the central nervous system, such as antidepressants, anxiolytics and sedatives, can have an even greater impact on the elderly. Another worrying factor is the so-called polypharmacy, the simultaneous use of several medications. This favors complex, often unpredictable interactions that can harm balance and physical safety. The importance of medication education. Many people take medications without fully understanding their effects, indications, or risks. This happens in part because the leaflets are long, full of technical terms, and medical consultations are often too short to cover all the details. But it is possible to change this reality. As patients, we need to take an active stance. Ask your doctor or pharmacist, why am I taking this medicine? What are the possible side effects? Is there a safer alternative? Likewise, healthcare professionals have a duty to provide clear guidance, especially regarding the risks of falls, interactions between medications and other adverse effects that can affect quality of life. Understand, balance goes far beyond the physical. When we talk about balance, especially in the elderly or in people who use several medications, it is common to imagine that it is just something physical, controlled by the muscles and the inner ear. But the reality is more complex. Balance depends on the integration of several body systems: sensory perception, brain processing, and motor control. In other words, any change in one of these areas can compromise its stability. Understanding this interaction is essential for a more comprehensive approach to health. By observing your body's signals, adjusting your lifestyle and maintaining your medical treatment, you can preserve mobility, safety, and independence, even as you age. Medications can help, but they also require attention. Medications are essential for treating a variety of conditions, but they can also cause side effects such as dizziness, weakness, and loss of balance. Recognizing these risks is the first step to preventing them. If you are taking any of the medications mentioned in this video and have experienced episodes of dizziness or unsteadiness, don't ignore these signs. Talk to your doctor. Often, a simple adjustment in dosage or switching to another medication can safely resolve the problem. Taking care of your health is an ongoing process. There are many measures you can take to prevent falls: exercising regularly, adapting your home environment, staying hydrated, taking care of your vision, and checking your medications regularly. The most important thing is to always be aware of your body and maintain an open dialogue with your healthcare professionals. Remember, aging healthily and safely is possible, with information, attention, and attitude. Share this knowledge. If you found this content useful, share with friends and family. The more people know about the risks and solutions, the more lives can be saved. And if you want, leave your experience with any of these medications or situations of dizziness and loss of balance in the comments. Your story may help other people. Stay here at Saudativa by watching the videos that are now appearing on your screen. They were prepared with the same care to help you live with more health, quality of life, and autonomy.